My name is Ninita Garcia, PSN1, P Service. Safe Drug Administration. Here are the introductions. Safe Drug Administration is a major practice done commonly by medical professionals to ensure that the patient will taking the right medications. In a healthcare setting, nurses are the major personnel who administer it. With the remark, here are the 10 rights to remember to ensure a safe drug administration. Right patient. 1,000 patients can come and go in a healthcare setting. As a nurse, we face 10 or more patients a day, and some of us might not remember the patient we faced yesterday. This is why we must always check the order and the name of the patients and if possible use two identifiers. We can ask them to identify themselves. We can also use technology if available to ensure that we are giving medication to the right person.
Kayo po ba si Ninita Garcia?
Yes.
Pasok!
Hello, sir. Good evening. Kayo po ba si Mr. Earl ng right medication? There are cases where two drugs look the same but have different purposes. There are also drugs that can need to be taken first before the other drugs because their content can't be taken at the same time. With that, we must always check the medication level or order of the drug. Because if we give the wrong medication to our patient, this medicine might put the patient's life at risk because his body does not need it and we don't want that to happen. So make sure to give the right medication to our patient. Right dosage. Drugs can be dangerous sometimes, especially when the dosage given were too much or too less. As a nurse, we had to confirm the appropriate dosage of our medicine or the given medicine to our patient. If necessary, we can ask other nurses to calculate those doses as well to make sure that this is the right dosage. Here comes the samples of all kinds of medicines. Right road. Medicine can be administered orally or intravenously, depending on the condition of the patient or prescriptions. With that, we have to check the order and appropriateness of the route ordered. Ask and confirm if the patient can take or receive the medicine by the ordered route, as some patients will have difficulty taking medicine in a given route. Right time. Medicine should not be taken too early or too late. We must always double check that we are giving the right ordered dose at the correct time because there is medicine that works for 12 hours and needed to be taken again for another hour or to the next day. Also, confirm when the last dose was given. Right documentation. After the medication is given, we must record time, route, and any other specific information as necessary. This is to keep track on the patient medication intake. Right assessment. We should check if the patient actually needs the medication use baseline observation if it is required. Right to refuse. We have to take the patient consent to administer the drug as they have the right to refuse the given medication. There are a variety of reasons why patients refuse medication, maybe because of their values or personal reasons. And as a nurse, this is okay. What most important is we explain to them the risks and the benefits of every refuse treatment. Right patient education. We must tell the patient that the purpose of the medication and tell them to contact healthcare professionals if they have experiencing or a side effect or reaction. Tingin ka lang sa akin. And of course, lastly, right evaluation. After administering the medicines, we must evaluate if the drug is working the way it should, have ongoing observation if required, and review medications regularly.
Okay.
So now you know the right or the 10 rights is utilized in any healthcare setting. If you plan to enter the medical field, specifically the nurse field, make sure to be familiarized with this. Once again, thank you, and I'm here as your nurse, Ninita Garcia, your healthcare also a reminder. Thank you. Bye-bye.